I'm eating well, I'm feeling much better, I'm not in crisis anymore, there were still some problems. And I'm like, there's something not right. Like, my life is pretty good. I should be feeling better. What's going on here? Why am I always like this all the time? Like clenching my jaw and like, and why do I have all these reactions? I was getting a rash a lot on my neck and my upper chest. Why is this happening? So connecting those dots again for me led me to discover, oh my gosh, I had the shortcut all along. I had it here and I didn't realize it. So that kind of blew my mind, because then I started giving myself the cofactors that I needed to support those enzymes.
Welcome to Personalized by VitaminLab, the show where we dive deep into the world of personalization in healthcare. I'm your host, Dr. David Duizer. Please remember that the following discussion is for educational purposes only, and it's not intended to diagnose or treat any disease. Speak with your healthcare practitioner first before integrating anything that you learned today. Join us as we explore the remarkable stories, breakthroughs, and possibilities that come with the pursuit of personalized healthcare. Welcome back to Personalized by VitaminLab. I'm your host, Dr. David Duizer, and today's guest is Jezel Rosa, a nurse practitioner and the founder of Level-Headed Mind. Jezel didn't find her way to holistic mental wellness through a textbook. She found it through lived experience. Burnout, resurfacing trauma, and a level of fatigue that conventional approaches alone couldn't explain. Her clinical background runs deep. She holds a psychiatric mental health nurse practitioner certification and additional certification in integrative medicine for mental health. But what makes her approach generally different is what she did when her own system broke down. Through functional lab testing and genetic insights, she discovered nutrient deficiencies she was genetically prone to. Deficiencies quietly undermining her mood, her energy, and her resilience. That discovery changed everything, not just for her, but how she now guides others. Today, Jezel works at the intersection of brain health, gut health, nervous system support, and personalized nutrition, helping people understand the biological factors driving their mental wellness and giving them tools that are science-backed, targeted, and rooted in real life. This is a conversation about what whole body mental health actually looks like and what becomes possible when you stop treating the mind like it exists separately from the body. Please welcome Jezel Rosa. Welcome back to Personalized by VitaminLab. I'm your host, Dr. David Duizer, and I'm here with Jezel Rosa. Good morning, Jezel. How you doing?
I'm good. How are you?
I'm doing well, thank you. I'm really excited to speak with you because you're working in a realm that I'm interested in and have no skills in. And that's always good for me to talk to someone who's got some expertise. So thank you so much. And I hope that our listeners get tons out of this session today, both about your clinical practice and how you personalize your care, but also about your journey as a practitioner and as a inpatient care, because it's quite unique. And I think it's really cool for people to hear about. So on that note, let's take a step back. Let's go back over the span of the full 20 years that you've been working. You've been working in crisis stabilization, medical detox, outpatient behavioral health, telepsychiatry. That's a super wide view of the mental health system. Is there a thread that's connected the whole thing for you? What has that been like for you?
Yeah, well, that has been, my journey starting in nursing since 1999. So it's been a while. It's been over 20 years. But what's connected it all to me has always been when I started looking back at things and when I made some pivotal changes in my career, it was always that patient-provider relationship, patient-nurse relationship. And the foundation of all of that is psychology and getting to build therapeutic relations. Hildegard Peplau is actually like the mother, you could say, of psychiatric nursing, and her book, Interpersonal Relations, really digs into the importance of a patient-nurse relationship and building that trust and that foundation. And so when I was deciding to go back to school, because I didn't start off as a nurse practitioner, I started off as a licensed practical nurse. And I did that for about 13 years before I went back for my registered nurse, and then going back, to get my nurse practitioner. So when I decided to go back and I was thinking of what direction I wanted to go as an advanced practice nurse, it was that thread that drew me into the psychology aspect and working in psychiatric nursing, particularly in that environment, is what really kind of connected all those dots for me as I was in school and learning more about the different nursing theories and practices.
Totally. That totally makes sense. Was there like a
Mhm.
specific moment where, you had a patient interaction where you thought, okay, this is the most important thing right now, and that may have changed the course?
When I was working in inpatient crisis unit and I was just about to finish RN school, a psychiatric nurse practitioner was covering for the doctor who would have been there. And I started asking her some questions and, talking about family nurse practitioner versus acute care nurse practitioner and psychiatric nurse practitioner, like the differences and why she decided to do psychiatric nursing and become an advanced practice nurse. And it was her, when she had spoken to me, it was, she was talking personally about her reason why. It was a personal reason. And it made me really think about like the thread that was also woven into this was also my personal journey. So it was not just my journey, but my family's journey as well. Because there are several family members that I have that deal with mental health issues, and a brother who was dealing with a lot of issues with addiction. And so I was like, oh wow, like I never thought like getting into this could help me understand it even better, like understand why certain things have happened in my family. What were those vulnerabilities? What made, my brother become what he was, at that time? And what made me different in that regards? And then, so it really like intrigued me in that way when she was talking about her reason, which was personal to her and her family and all that. And then I thought, oh my gosh, I never thought about that, like that end of things, because there were a lot of questions that I had in regards to the why. Like, why, is my family like this? Why do we have these vulnerabilities?
Oh yeah, completely. No, no, that makes total sense. And it's a common theme that we hear like within both naturopathic practice and functional medicine and nurse practitioner practice. It's like the family, being inspired by the potential to support family members and those closest with you, and actually then seeing them change, and that being so inspiring, right? And then
Hmm.
being able to make such significant clinical changes on a day to day for people because of the experiences that you've had. And so, was this like the integrative and functional medicine kind of approach that you stepped into at that point to support your family, or is this more of a conventional approach before then?
At this point, it was more my direction to go into advanced practice nursing and decide, because I knew I wanted to go further, but I didn't know so I do psychiatry because my experience is pretty broad
Hmm.
with emergency room, med surge, crisis units, and all that. So I always worked like two jobs.
Right.
So I always had my foot in multiple doors as a nurse. And so I was like, well, which area should I go? So that conversation led me into psychiatric nursing specifically.
Hmm.
What wove me into the integrative functional medicine side of things was actually my own personal experience, but also when I was in psychiatric nurse in school for psych NP, we actually had a complementary alternative therapies introduction course. And that was like, it really blew my mind, all these different modalities because I was not exposed to that in
Hmm.
my work, because I was working at that point in a crisis unit. So we're getting mental health crisis unit, you're bringing people in, they're there for 32, 72 hours, depending on the situation, et cetera. And you're working on crisis management and then also detox. So that's also inpatient. And so I was like kind of seeing that area of medicine, like the very like conventional side. And when I started learning about the complementary approaches, even to these things, like for people, it really opened up my mind, and it brought me back actually to my childhood because my mother actually always used natural remedies for us growing up. And that came from poverty. We were poor growing up. And so she utilized food as medicine teas, honey, like we didn't go to doctors,
Right.
which I think helped, as when I go back and I think about things like that, I think that really helps strengthen my immune system and those types of things.
Yeah, very cool. Very
Mhm.
cool. Goodness. Yeah, that's so were you using herbs when you were young too, or is it mostly through food? Like what were some of the things that you were using?
Yeah, so honey was definitely one, and then a lot of herbal teas. There were a lot of different herbal teas that my mom would get, and she would use a lot of ginger, and she would use like fresh lemon and like just
Yeah.
different concoctions she would put together. Garlic sometimes, like do a thing of garlic, and it was just
I think it's important for young people. Like I don't think you need to be poor to use them. I think that's really cool that you had that experience and that you saw benefit in that.
hydration was also like water. Make sure you drink your water. Like I remember like pounding water to make sure we were hydrated before we went to school.
Love it.
So yeah, there was a lot of that. But yeah, at the time I didn't appreciate it because I'm like, why do we have to do all this stuff? And I'm like, oh, like some of the teas were bitter and they didn't have a good taste. And yeah, so there was a lot of disdain or something, as a child and a teenager even, but now I look back and, of course I always thank her for that.
Mm-hmm.
VitaminLab revolutionizes personalized supplements, empowering health practitioners to create tailored supplement formulations that address each patient's unique needs. Bring personalized health to your practice and choose from over 200 professional-grade ingredients to create vitamin formulas that improve patient adherence and result in tangible outcomes. All ingredients are sourced from the world's most trusted suppliers, and VitaminLab provides hands-on support to help you formulate and launch personalization to your patients. Say hello to a new era of personalized supplement solutions. Go to getvitaminlab.com/personalized to save $100 off your first formula.
Oh, totally. What you're describing here is a common theme that we see on the show and that we have to have discussions around, and that's about niching down in your practice or
Mhm.
keeping a really broad approach. And, as a nurse practitioner, or, training to become a nurse practitioner, you had kind of a different experience than what naturopathic doctors get here. We're always talking about, should we use the full scope of practice straight away and that be our thing? Or should we niche down and do one specific thing or work in one specific condition? But what you're describing is that you were thrown into all these roles and you had to have expertise in so many different places. And then over time, through education and just being inspired to learn, you were able to not necessarily niche down, because it sounds like your approach is incredibly broad, but focus in on one kind of method of practice. Is that true, the way that I'm describing it?
Yeah. So my journey with the advanced practice nursing and how I veered into specifically what I'm doing now, an integrative and functional mental health practice. Yeah, like I started in out of college in the conventional community health, mental health space. And that's like very brutal. You're seeing patients every 15 minutes, 40 minutes for like an initial. So you have to be real quick with, these diagnoses and handing out medications and all of that. And I thought that I had to do that. I thought that I had to get like that under my belt. I always knew that I wanted to veer off. So I was, while I was working in that space, I was taking courses. I stumbled across Dr. Leslie Korn, Dr. Greenblatt's work. I had a mentor who was also very pivotal, a nurse practitioner, Daly Granger, and she introduced me to Dr. Jay Dunn. So all of these connections were kind of happening while I was like, I felt forced into the conventional space. But yeah, so being in that and then also on the side kind of working with these mentors and learning from them and getting more of this under my belt, I started attempting to implement it into the community mental health practice that I was at. And it was through that where I started seeing change. People who actually wanted that. Not everybody wants that. So that was something that I also found to be a bit shocking, but at the same time, it really opened up my eyes that what the problems are in our society, which is we are ingrained, we are programmed to a pill for every ill.
Yeah.
And so that's kind of what got me into like I have to think differently, thinking outside the box, like, and then eventually out of the community mental health setting and into my own practice, because that setting wasn't really feeding or nurturing my desires to help people the way that I believed I could. And while working in that setting as well, I also stumbled across problems with the medications themselves causing protracted withdrawal and benzo-induced neurological dysfunction, which took me on a whole other path. It really opened up my eyes, and I thought, oh my gosh, I don't want to be part of the problem anymore. I want to be part of the solution. And so level-headed mind for me was creating that solution and not being part of the conventional medicine space anymore.
Very cool. Yeah, I love that. Absolutely. Tell me about where your journey comes in, because I know within your journey of through burnout and significant fatigue and this, you were kind of tuned into functional lab testing and genetic testing. Walk me through that experience.
Yeah, so this actually, I had a really significant crash during the pandemic. So this was right in the middle of it in 2020. I started having some signs of it in 2019. I was working at that, my two jobs, and I was finishing up my internship for my nurse practitioner. So I was already burning the candles at both ends, and I was starting to have like periods waking up, feeling like, oh, my blood sugar feels like, and just passing out.
Oh,
And my husband would be like, what's wrong with you? Like I'd be passed out in the bathroom, or I'd try to go back to bed because I felt like I was passing, and then I just hit the bed. And I thought, oh, it's my blood sugar. Like I was like trying to figure out what was going on with me. Of course, later on, I realized, oh, that was burnout. That was, me working too much and being in school and trying to do everything at once. So it started then. Then the pandemic hits. So now one of my roles was a clinical director at that same crisis unit. So I kind of went up the ranks there. And so it fell on me, when people were calling in sick and they were afraid to come to work. So here I am, like basically living there, like sleeping there in my office.
Goodness.
Yeah. So I could be at work, be present and help these people and try to create SOPs and do all this stuff. Like, cause these were new things for us. Like, in a standalone crisis unit, you don't have a hospital. So we didn't have like PPE and like a ventilation room and like an isolation room. So like I had to create all of that, and I had to like teach it to everybody. So it was just like so much. And I just started not sleeping. I was gaining weight like crazy during this time. So I gained a lot of weight. I got up in the 200-pound range. And for me, like my ideal weight is like 150. So yeah, there was that. And then I also just started having a lot of reactions to things I was eating. At that time, I was working with a mentor she's the one who was like, maybe you need to look at like your genetics or look at like some other things. And she's the one who like got me into doing this testing.
Cool.
And so, yeah, so it was Daly who actually like brought up that this could be some other things going on. And to her introduction to Dr. Jay Dunn, who is the creator of My Happy Genes, I went ahead and did that test, but I didn't really understand it, to be honest, at that time. I was like, what is all this? This is like crazy. And then I started at the same time learning about leaky gut and gut health through Leslie Korn's program. And so I just started applying the principles. I did a leaky gut test. It was positive. I had high markers of LPS. So I started like working on my diet, doing exercise, like all the stuff you're supposed to be doing. And I had to make some really tough decisions, and I had to actually quit my job.
Wow.
Yeah. Yeah. Because it was affecting my mental health so bad that I was so I have a history of childhood trauma. And it wasn't until this happened that those memories started flooding back. And so I was having nightmares, like I was waking up having nightmares, reliving the traumatic events. And it just shook me to my core. And I had to make that pivot. And so like, thankfully, my husband was very supportive of the decision. We were able to push through and get through, financially speaking. And it was just like one of those decisions where I felt at that moment as a failure, just because like I couldn't keep up with what my norms were, but that's what burnout and all like resurfacing trauma and all that does to you. Anyhow, so it was this long journey. It took me about a year, actually, to get myself. I was able to graduate on time and all of that, but that was tough in and of itself. But I took a little bit of a break afterwards and like kind of reset myself and then started working. But after that, I really started taking notice of how using these skills, and that skills before pills approach really was born within like my own experience when I was looking back and thinking like, how do I help people in mental health, knowing that, the psychiatric conventional medicine side is hurting people. How do I break free from that? And then I started thinking about, well, my journey, because doctors, when I started going to doctors because I was having trouble sleeping, I'm passing out, I'm not feeling well, they wanted to give me pills.
Completely.
So I was prescribed trazodone, I was prescribed temazepam. They wanted to put me on blood pressure medication, but I did not do that. I did try the trazodone and temazepam, but I had reactions to those. I was too groggy, had low blood pressure. I was passing out, like all these things, even worse than before. So I couldn't tolerate psychiatric medications. And then later I find out all the harms. So I was like kind of grateful that that happened because maybe I could have ended up with a more serious injury. But yeah, so it was all through all that when I was like, okay, I couldn't use medicine, it was causing more harm for me. I was having these side effects. How did I get through it? And then that's when I was like, okay, I use these skills, like I learned how to regulate my nervous system. I learned a lot of vagus nerve exercises, breathing techniques from the diaphragm, meditation. Like it was all going back to the basics. And of course, the exercise and the diet, I believe that was the most pivotal because without the exercise and the diet, I don't think I would have had the mental capacity to engage in the skills.
Completely. Were those guided by the labs? Not to get too personal, but I mean, you're going down this road, like the genetics and the functional labs. Did that influence your program?
So the genetics gave me a lot of question marks because that test, it tests for over like 600 genes. So it was overwhelming, but it also had like these sliders to try to make it easy for you. Like, are you prone to say bipolar or mood disorder or depression? So my depression one was high. And of course I was through all this feeling depressed. And then of course, like the stress part was also high. I didn't understand it at the time. Now I do because I realize I have genes that make me more prone to like PTSD, anxiety, and depression. It was the leaky gut stuff that I could understand that better. So that testing, when I was like, oh my gosh, I can't believe I was doing this to myself, was the driver for me to like change my diet, start exercising, because like I knew LPS was toxic and I knew what it was doing to my brain. I had a good understanding of that. And when I saw my LPS levels as elevated and in the severe range, I was like blown away. And because I thought at that time, like I was trying to eat healthier. So yeah, I just was like, I went full into it at that point because I knew what it was doing to my brain and my body because LPS is a driver of neuroinflammation and just chronic inflammation. And it's oftentimes one of the things that is very insidious. So meaning like over time, like you can have LPS levels and still be living and still thriving, but underneath it's creating a lot of inflammation, causing insulin resistance, which is why I'm gaining weight, right? This whole time, metabolic syndrome issues. And then of course the neuroinflammation, depression, anxiety, like why is all of this happening so fast, so hard, so quick? I could have blamed it on the pandemic. There was a lot of stress involved there. But the leaky gut factor made me less resilient.
Right. Yep. No, smart. Absolutely smart analysis. And this is what we want from our health coaches and physicians and top team members and nurse practitioners and even from our YouTube commenters and educators in the health space. We want people who, or this is what I want, who have the educational background to do the integration, who then have the experiences, whether it be with seeing absolute change in patients or within themselves. And so you've got both. You've got this very wide background of experiences with both conventional and now integrative and functional approaches, and you have your own personal experience. And so you made the transition to becoming a communicator, an educator. And I'd love to hear about that because, it sounds like you were taking on a lot, and now you have transitioned to this type of coaching, this type of support that I've read about on your profile, but you're also doing this educational. So what does that leap look like from, inside the conventional system to burnout to YouTube channel, coaching program, online presence? It's got to feel completely different and risky in some senses and
Oh,
sort of
yeah.
liberating in other ways. What's it like for you?
100%. Yeah, it's definitely the road and the shift. When you decide to step outside of the box, it's very lonely. So this is not an easier road. When I think about oftentimes like I'll think maybe I would have been better just kind of sticking to because it would have just become very normal for me and just kind of like, oh, take this, take that pill, take this pill, and just kind of close Pandora's box and act like as if I never saw it. But that's not who I am. I couldn't do that. So in a lot of senses, this stepping out is actually harder than staying in. And so the purpose for the YouTube channel, that was step one for me. And the purpose of the YouTube channel for me was to educate people on the medications because I didn't have time in my quick sessions that I had with patients. I was still in community health at this time to give them all the information. And my husband has a big YouTube channel now. Back then he was building his channel. So I learned a lot from him.
Mm-hmm.
And I started seeing people like Dr. Tracy Marks when she had like 100,000 subscribers. Now she's got, over 1 million. And then he was like, you could do that. That could be you. And I was like, I don't know if I can. He's like, yeah. He's like, what is it that you want to teach people? What is it that you want? And then he got me thinking. So I was like, okay, yeah, people don't know about their medications. I feel bad that I can't tell them about not only what it can do, but the side effects and all of that, so I said, that's where I'm going to start. So that's where that was born. It was born out of necessity to teach the patients. And so I would say, okay, watch this video. This is a medication I'm prescribed.
I didn't know that. You were still in the conventional side when you started it.
Yes, I was. Mm-hmm.
Love it. Very cool. So it's like a resource. So you're resource building, you're getting questions, you have unanswered things. I love that.
I was resource building. It was something I could say, watch this. When I learned about bind and injury and medication side effects and protracted withdrawal and antidepressant and all this other stuff. So as I'm learning, the YouTube channel was also a way for me to reinforce my learning.
Mm-hmm, mm-hmm.
So as I stepped out of conventional medicine, my YouTube channel starts shifting. Because you see, at first, it's all the medications because it's like, okay, I need to rapid fire all these medications in here so I could, let my patients know about them and let other people. And then I started realizing at that point in time, there weren't many channels at all talking about medications, psychiatric medications in particular. And so there was this huge need and this big gap. And then I was like, okay, I need to make sure I'm also aligning this with my values. So I would always tell people, towards the end, remember, it's not about the medication, which medication is best for you or how do you decide that? You want to start with your lifestyle first. You want to start so I would start including that messaging in the medication videos because I wanted to basically take this audience who's programmed to medication first and explain to them that there's another way. And so that was the purpose of that. Then as I stepped out completely out of community mental health and into my own practice, that's when I started building on my skills before pills. Why am I moving towards skills before pills? What is my philosophy? What are the skills? And then building on the foundational skill, which a lot of people think it's the breath work, it's the mind work. That is important. But like I was saying before, you oftentimes can't tap into that until you fix the biology. You have to lower the inflammation. And you do that through diet and exercise. And so it's understanding that and then teaching people because it's basically the way I look at my channel is it's educational, number one, but it's also for people who can't afford services otherwise, so it's free, right? But also number three, the way I think about it, it's reprogramming.
Right.
It's sending the message to reprogram America that medications aren't the only answer, and they shouldn't be the first solution when you're having problems with mental health. You need to consider a lot of other factors. And so that is what drives my channel now, is that messaging. So I've basically stopped medication videos. Like, I think my last medication video might have been a year and a half ago. And I just started focusing solely on nutrients, diet, lifestyle interventions, how it all intertwines, and genetics. So most recently, genetics. Since April of last year, I started really diving more into genetics. I reopened my genetic test. And since then, I had taken other genetic testing, and I started diving into that more because I was like, this is the missing piece.
Yes.
And it was like, that was another box that I opened, and I was like, oh no.
Okay, and I know it can be completely transformative. Like, let's close the loop here. You called it level-headed mind.
Yes.
What does that name mean to you? How'd you come up with that one?
Well, actually, that was just from brainstorming and looking and seeing. So I actually had a notebook, and I filled pages of different names and different things. Level-headed, that word itself kept popping up because a lot of people, a lot of my friends and family say that I'm level-headed. Right. I'm the level-headed person of the family. I'm the level-headed person of my friend group. They come to me even before I was a psychiatric nurse practitioner for guidance, help, support, and all, because that's just the way I am, or the way I perceive myself, even if through my struggles even. But so that word always was like a word. So I was playing around with that word a lot, level-headed mind, and all these. And then I was taking the different words and I was seeing on domain names, like what are available.
Mm-hmm.
And level-headed mind was available. It was affordable. So there were the other terms. I can't remember them now. I'd have to go back into that notebook. There were other terms that I thought would have probably been better, but they were already either taken or were being sold for something I couldn't afford, for a price I couldn't afford. So it kind of just came out of that process of brainstorming, looking at what was available as domain names so I could capitalize on that domain name and then go from there.
And you've got a personal connection to it. It reflects pretty well on how you, like you said, how you look at yourself and how you think other people look at you. So really cool. I love that. And so then we dive into genetics. And over this last period of time, last few years, you've been going kind of all in. And this space is rather new on the, mental emotional wellness side, although people have been talking about it. I think really for me, it's like around the pandemic is when I started hearing about it. And I remember this one person I was working with kind of either just pre-pandemic or in the middle of the pandemic, who had a genetic test and found out their COMT and the MTHFR genes and the presentation of them. And I had no idea. Like I was not in the space at all and had to learn pretty quickly how to support them, but made some mistakes. And I'm sure that you're familiar with like the most common mistakes that people make.
Oh yeah.
As I read about your approach, it seems to be centered around not making those mistakes and actually connecting the dots as much as you can among the genes that work together. Do you want to talk me through or walk me through your approach to genetic assessment and how that kind of informs how you treat?
Yeah. So first of all, when you mentioned the genetic mistakes, that was something that when I was first learning about genetics, it was through nutrigenomics, or not nutrigenomics, pharmacogenomics. So learning about gene site testing and how the medications are metabolized in someone versus slow metabolizer versus fast metabolizer, et cetera. In that test, at the end, there's COMT and there's MTHFR. That kind of sparked my curiosity because I remember seeing those genes in tests that I had taken. And I was like, wait a minute. Okay, what is this? So when I started working with patients looking at genetics, it was the pharmacogenetics first. Then I was like, okay, but wait a minute. These two genes I think are more important than the pharmacogenomics or genetics that are involved here. And so I started studying those. Then through that, I started realizing, because I started making those mistakes that I now teach people you don't want to make. Okay. Because just like everyone else, I started focusing just on MTHFR, just methylfolate, methylfolate. Well, that works for a lot of people, but there's also a subset of people where that won't work for, and you actually could do more harm.
Makes them worse.
Exactly. It makes them worse. Then I was like, why? Why is this happening? Why am I seeing these people that I'm making them worse? So I started digging into that more. I learned about overmethylation. Well, what causes overmethylation? Okay. Then, but why? So I kept digging in. Well, because you're giving methyl donors to all of these other enzymes that are feeding off of the methylation cycle. So COMT is a good example. Catecholomethyltransferase. So anytime you see MT in an enzyme or methyltransferase, it's a receiver of this methylation cycle. So when you upregulate MTHFR with methylfolate, you're upregulating that cycle and you're feeding COMT a lot of SAMe. But what if it's slow? What do you think that does? It causes a backlog. It cannot support it. It does so without supporting COMT first, and you slam the gas. So I look at it as the gas and the brakes. You can create a lot of anxiety, a lot of reactions, because COMT isn't just catecholamines. It also breaks down estrogen. So you'll see a lot of women having issues during their menstrual cycle, having more reactions. And then there's another enzyme, HNMT, which is histamine N-methyltransferase. So again, it's taking methyl donors. If that's not working properly and you try to upregulate it, you have another issue now. Now you're reacting to things. So when I started learning all of that and context, and I started going back into the My Happy Genes test, because that one was looking at everything. And Dr. Jay Dunn teaches something called holistic methylation. And it's like this huge chart. And I was like, oh my goodness. It was very overwhelming for me, like I said back then, when I didn't really have any true understanding on genetics. So I kind of was just like, okay, like I can't understand all this stuff. Okay, I see I'm prone to depression. I'm prone to anxiety, PTSD, okay, I got it. But when I started going back into it after learning, I was like, oh my goodness, this makes all the sense in the world now. Because I started seeing all of my pieces. Like it wasn't just, I have an MTHFR, I have the AC, not the CT one. And I also have COMT, I don't have MET-MET, I have VAL-MET, but I also have HNMT, 2 variants there. And I also have a VDR variant and GC binding protein. So when vitamin D, so there were all these dots I'm connecting in this big cycle. And I'm like, oh, wow. I'm like, okay, so this is where, because even though for me, I'm eating well, I'm feeling much better, I'm not in crisis anymore, there were still some problems. And I'm like, there's something not right. Like my life is pretty good. I should be feeling better. What's going on here? Why am I always like this all the time? Like clenching my jaw and like, and why do I have all these reactions? I was getting a rash a lot in my neck and my upper chest. Why is this happening? So connecting those dots again for me led me to discover, oh my gosh, I had the shortcut all along.
Wow.
I had it all along. I had it here. And I didn't realize it. So that kind of blew my mind, because then I started giving myself the cofactors that I needed to support those enzymes, then do the methylation part, the methyl. Because after you give yourself the breaks with those enzymes, then you can push the gas and you can improve methylation, and it all starts working together. But you have to make sure the brakes are there first and that you're supporting all of the downstream effects of upregulating methylation. So you're supporting detoxification pathways, transsulfuration pathways, in particular, your histamine pathway, your neurotransmitter pathway. So it's not just COMT, it's also MAOA. And then also your dopamine, your vitamin D, which is a very key. That VDR receptor gene is so important because it's actually a precursor to feed all these other pathways as well. So when vitamin D is actually low, that's one of the first things I look at. Zinc, B6, those are all very important cofactors and nutrients. Copper, and if copper's too low or too high, you could have problems. Same thing with zinc, So it's like looking at all of this in balance and putting the pieces together, and not just looking at one gene, MTHFR, and saying, oh, you need methylfolate. No, it was like taking a step back and saying, oh, wow, like we need to be looking at all of these cofactors and then figuring out why and where are the different roadblocks that this person has that can potentially cause problems if we say, we give someone methylfolate or B12, like, because there are genes that are like MTR, MTRR, and your TCN genes. Those can be slow or non-functioning properly. So if you try to give them B12 without seeing the whole picture, it's a similar thing with methylfolate. And so it's like, okay, those are the gas. I need to work first on the brakes and make sure all of that is in place. Then feed methylation, because methylation is very important. But if you look at it singularly by itself, you're not looking at the whole picture. And that's where problems will arise, because it's a very powerful driver of all of these other processes. So it is one of the most important factors. And MTHFR is a very important gene. I do agree with those statements that people say, but it's not the only thing you should be looking at. So when people, like, there's ads out there, you should get a methylation test. MTHFR is the most important gene. You have to look at it in context, because it's not the most important gene when you have all these other genes that are impacted by that MTHFR and by upregulating that methylation cycle.
Completely. Yeah, no, very well put. Very well put. Can we simplify for myself personally, one example of cofactor requirements? Say, for example, downregulated or what is the correct terminology? Inefficient COMT.
Yes.
What would be some of the cofactors that would be important in that setting?
Yeah. So magnesium is very important for COMT stabilization. So when someone has a COMT, especially a MET, I know right away they're going to need magnesium, especially if they're showing epigenetics. So symptoms are your epigenetic expression. I want to make that clear too, because some people, they just see that they have something and then they start taking nutrients, but you need to make sure like it's turned on. So if they're seeing me, we're talking about symptoms, most of the time, a lot of these things are turned on, right? But if you just have a genetic test and you're looking like, oh, I should take this, this, and this, not necessarily. So if you're having symptoms of anxiety, inability to fall asleep, your mind is racing, you feel wired but tired, and you have the COMT MET variant, magnesium glycinate is your friend. Now, nuance here with magnesium glycinate versus threonate. There's been a lot of research, and I believe this happened in the early 2000s, because around 2020 is where this shift started happening, where practitioners started shifting from using magnesium glycinate to using L-threonate, because Magtene, the branded magnesium L-threonate, did a lot of research. No one's researching magnesium glycinate to the extent that they're researching L-threonate, because there is a financial gain for that. I say all that to say that when all this was happening, I kind of fell into the trap of like, let me give magnesium L-threonate. It crosses the blood-brain barrier. Well, guess what? Someone who's already revved up with anxiety and all that, you give them magnesium L-threonate, they're going to be more wired. They're going to be more, and it's not going to work. And then you're going to think magnesium doesn't work. It's the form. So you want to use glycinate. Glycinate, I believe, does still cross the blood-brain barrier, but because it works peripherally, like, we have receptors, not just in our brain, but we have GABA receptors throughout our whole body. Like, people always think it's just in the brain. And there is a peripheral effect that magnesium has that then in turn through our vagus nerve speaks to our brain for calming. And so there is that effect. And that's why when you take a magnesium supplement, like a magnesium glycinate, you feel your muscles feel relaxed, your body feels relaxed, and then that gives the signal to your brain to relax, to settle down. And it's also helping the stress response in that energy cycle of ATP and driving your adrenal glands, which happens with COMT, catecholomethyltransferase. It's basically driving your adrenal glands. You're producing more catecholamines, and you can't recycle them. You can't break them down. So they're hanging around a lot longer. Magnesium goes in there as a buffer. So it's not necessarily a cofactor for COMT, but it's a buffer for COMT. So it helps to buffer that extra. It basically says, okay, I'm going to come in here and help you reduce the stress load and help you to break down those catecholamines, because magnesium is powerful in that way. Then the person can start settling down. Other cofactors for COMT after you put the brake on first with magnesium would be your methylation, your B. So like your B2 riboflavin, which a lot of people don't talk about riboflavin, but very important also for MAOA. Your B6 is very important here. And then the B9, and then, your folate, and then your B12. So kind of going in that order, like kind of phasing them in slowly, but after the breaks are in there. And sometimes if someone has COMT and they have other genes involved with, say, estrogen metabolism or detox pathway genes as well, then you're going to want to look at that before you put the gas on methylation first. So maybe sometimes in that case, someone needs sulforaphane or DIM, to help with those GST genes and the different genes, glutathione transferase genes, to help them process out because once you start upregulating COMT, guess what happens? You're now detoxifying more. But if you don't have proper detoxification pathways, then now you can expose someone to reactions and having problems there. So with COMT, magnesium's always first as the buffer. Then I make sure before I start putting the gas on methylation, I'm like looking at more downstream detox pathways, hormone pathways, and seeing, okay, do they need support here before I put the gas on their methylation cycle?
Yeah, totally makes sense. And you mentioned a couple times about the timeline. What are some typical timelines that you might consider for the stages?
Yeah, so stage one with the buffer is usually about 4 to 6 weeks, and it's basically finding the right dose and time. So meaning most of the time it's nighttime because it's accumulating over the day. So start there. Some people need a little more support during the day, and then so there are other supplements, amino acids like L-theanine, for example, not a cofactor here for COMT, but can help in that stress response cycle and pairs really well with magnesium. So sometimes, we need to add that in. So during that 4 to 6 week period, we're figuring out what is your dose that's going to help bring your symptoms down. And do we need to bring in an extra support for that magnesium? Do we need to bring in something like L-theanine? And sometimes even GABA can be helpful. Just depends on the person's experience. Mm-hmm. So that phase is about a 4 to 6 week phase, depending on the person, how severe they are, and if there are other things going on in those other pathways. Then things start to reveal themselves when you upregulate COMT. Like I was saying, you kind of stabilize that. And you see, okay, this person is having a lot of hormonal issues, for example. That'll start coming to light within that 4 to 6 week time frame. Then that's when I start to, okay, we need to give this person now, like say sulforaphane is a good nutrient to take. You get it from broccoli sprouts, but there are some supplements now that contain, broccoli sprouts, but you need to have it with myronase and some probiotics and things like that so it's converted properly. But that really helps actually to upregulate a lot of the genes involved in detoxification and hormone metabolism. Mm-hmm. So oftentimes that is it. If it's just a couple, if that's not it, with a lot of the GST genes, sometimes we'll use DIM, right, which is also something that helps break down specifically hormones if it's more hormone than detox related. Mm-hmm. So there's a lot of like, what if this, then this? Yes. Algorithm in my head.
Makes sense. Yeah, to personalize.
Yeah. There's a lot of if this, then this happens, and then the timeline of that when that happens and what it is changes for each person. Because if it's just COMT, which is rarely the case, but there are people where it's like, oh, they have all these other healthy pathways. It's really just the COMT and their methylation pathway. Then that's pretty simple and clear. We give them the breaks 4 to 6 weeks in. We start upregulating their B vitamins and we start B2. And if they tolerate that well, then I start adding in B6. And that's within like a couple of days to a week, just to make sure that they're not having an adverse reaction. And then I start bringing in the other cofactor, the other B cofactor. So I start with B2, B6, then B9, then B12.
Yeah, makes total sense. And like in this realm, it's such a sensitive space working in anxiety, depression, and in schizophrenia, I'm sure, and bipolar. It's such a sensitive space. If you make a mistake or if you don't communicate it effectively, or if things go sideways, you need to be able to handle it very quickly and be very supportive of people and teach them about long-term outlook and what this means and that means. And that's really where the personalization comes in and your ability to communicate that effectively. And it sounds like you've really got that. And I remember as a young naturopath not having that. And that being the stressful bit for me is like, I want to personalize. I want to be that guy.
Yeah.
But communicating that is a challenge.
Oh, for sure, for sure. And but I think people get it. Like once they kind of go down this route of natural medicine and they start taking a lot of things and they realize like, oh, they're trying to self-diagnose and self-treat, and they'll run into their own mistakes. So then they realize the value of this personalization. And with VitaminLab, they make it very easy for a practitioner like myself to kind of step someone into their own supplement, So it makes it very easy for me to go in and say, okay, like this is their first set of labs. I see that they need all of these nutrients. I'm going to give them, I'll start them off with like just a plain magnesium, but then once I scale them to what they need, then that's like, we do that for at least 3 months.
Protocol, right.
Yeah. Then we do that for 3 months. Then I recheck the labs. Is there something we're missing? Like, is there, and look and see if I see trends are in the right direction, we'll continue it. If I see, okay, they're not getting enough of, let's say, B12 is still low. And I know that there's a risk factor there. And depending on how they're feeling, I'll say, okay, let's give you a little bit more. So then their next batch, we may increase that B12.
Right.
And then we kind of like play with that until we realize, okay, this is stabilizing you, because we checked your labs 3 months later. Everything looks very optimal, which I think is also key. Not everybody optimizes their nutrients. That's a whole other topic. But, people see a vitamin D of 32 and they think they're in the safe zone. It's like, no, that should be at least 50,
right.
So things like that, making sure that we've got the right amount, we've got the right forms for the person. And then once they have like their stack, then it's just on auto, auto ship and auto, and then we just do we kind of scale it back every 6 months, every year.
That makes total sense. Yeah, I love that. It makes total sense. And, one thing that kind of informed the conversation that we had and started us off down this path was your leaky gut experience and the LPS and the damage that has occurred. And I think one of the things that, helps someone like you really stand out is your experience with that. But also people in our profession focusing on like actually getting the absorption, right? Right. And making sure that a lot of us believe that the digestive tract is the foundational piece here.
Big time.
The genetics, we might think that's the foundational piece, but if you can't absorb the nutrients, then it won't matter. Would you agree with that? Like, do you think that that's where the idea should begin?
100%. So in my symptom assessment questionnaire that I have people take, I ask a lot about those factors, like different symptoms that they could be having. That clues me into we need to add like a GI map or, add a test that's looking specifically at that. I like to do oats as just a basic organic acid test, which sometimes you could see covert GI there in the microbial section of that report. And sometimes not so much. You have to look at the stool. But I decide that based on the symptoms the person is dealing with. And especially if someone comes to me and they're already on a bunch of supplements. So they're showing me like their grocery bag of supplements and I'm doing this and I'm doing that. And I'm looking at their labs and I'm seeing like poor, low. And I'm like, okay, this person isn't absorbing. That is such a huge red flag that before we do anything, we need to fix your gut.
Right.
And we need to look at what's actually going on. And I do like to do a GI map, because fixing the gut can also be another rabbit hole you go down where everyone thinks just probiotics. And that's not always it. Sometimes you got to fix your digestive enzymes. H. pylori is often a driver of a lot of these things. And if that's there, then we've really got to work on that, because if you're just trying to give yourself probiotics, H. pylori will still linger and cause the low stomach acid, low motility, all of those factors that got you to where you are. So looking at that is very important. And then looking at sometimes food sensitivities if someone's reacting, where you can check food sensitivities and then look at blood levels of LPS as well. Like I said, that was one of the drivers for me. I was like, oh wow, okay. I not only have all these food sensitivities, I have elevated LPS on top of that, with everything. So yeah. So showing people that, like, once they see it, that's the motivation. Because it was clear for me, like once I saw it, it was like, oh my goodness, like I got to get my act together,
Completely. Well, extremely well put, Jezel. And like, that's why part of the reason I love doing this show. I'm talking with a genetic expert and spent an hour and didn't talk about MTHFR. Like, that's how holistic I think we actually need to be, and like organizing our pillars and figuring out where the priorities actually stand. And if pillar 1 is digestion, then that's where we spend time. If pillar 2 is downstream genetic challenges that might make your typical MTHFR approach like less effective or even harmful, then you need to go down that path. And that's why I just absolutely love what you're doing, and your kind of nutritional exercise lifestyle approach to this, I think, is like really powerful, and I'm so excited for you and for it. I tried to build a bit of a career around in this realm back in the day, where I was doing virtual reality therapy and trying to integrate nutritional approaches, and I just didn't have it. And I think that the way that you've described this and highlighted your kind of step-by-step approach, I think is quite inspiring to me to, kind of help people build those foundational pieces. So thank you so much, Jezel. I'm really, really into it.
Thank you. Thank you so much for having me and for being here. Yeah, I think it's great that people need to learn about this. And I think it's great that you're, putting this out to the masses and allowing people to learn about not only, like you said, the genetics, but all the other foundational pieces that you need to have in place. Because without the foundation, the house collapses, right?
Right. Completely. Where can people find out more about you and learn, kind of how to either, review the content, or like what's your YouTube actual handle, and where can they connect with you if they want to work with you as a client or as a patient?
Well, yeah, levelheadedmind.com, all one word, is my website. And then the YouTube channel is the same name, Level-Headed Mind. Level-headed, one word, and then mind. But if you just type Level-Headed Mind, it'll come up.
Excellent. Excellent. Well, thanks so much for your time, Jezel. I really, really enjoyed speaking with you, and I hope to talk to you again soon. And I'm really looking forward to people, hearing this episode and integrating some of the ideas that you have and connecting with you more.
Thank you so much.
Talk again soon. Bye.
Bye-bye.
Thanks for joining us for today's discussion. What about today's podcast resonated with you? Be sure to tag at Dr. David Duizer and at Get Vitamin Lab. If you're learning from and enjoying this podcast, please let us know by subscribing to our YouTube channel and follow the show on Spotify and Apple. And don't forget to leave us a review. It's the best way to support our podcast, and it helps others find us. To learn more or book a demo to explore what personalization could do for your practice, please go to www.getvitaminlab.com/personalized.